Welcome to the webinar on Vital Signs Core Metrics, Learning from the California Demonstration Project. My name is Claire Wong. I'm a Senior Program Advisor from the National Academy of Medicine and your host today. This webinar is being recorded. A link to the recording will be posted on our website within the next week or so. If you have any technical issues on WebEx during the event, please contact WebEx technical support at 1-866-229-3239. For those of you who are joining us on the phone only, you can access the slides from the webinar event page. In the next hour, you will hear from three panels. Mike McGinnis and myself from the NAM's Leadership Consortium will give a high-level overview of the ongoing activities on vital signs core metrics for health and healthcare progress. You will then hear about the first pilot project to implement vital signs in 2 communities in California, followed by a reaction panel to briefly share their thoughts on the opportunities and future directions for implementing vital signs framework in different settings to reduce measurement burden, sharpen focus, and improve performance of health systems. We'll be taking questions through the Q&A box located in the lower right corner of your screen. Simply type your question into the box at any time and click send. We ask that you leave the box set to send your questions to all panelists. Please note that any questions that you submit may be read aloud and included in our recording. With that, I would like to turn things over to our first speaker, Dr. McGinnis.
Thank you very much, Claire. Thanks to you not only for the work in putting together the webinar with our colleagues in California, but also for stepping up to the plate and serving as our point person for implementing the vital signs activities across the nation through the National Academy of Medicine's activities. I also want to give thanks to our other panelists who have joined in today, obviously to Steve Teutsch and Sue Grinnell, to Krista Haney, who is right here next to me. Fortunately, she's come in from Monterey County Health Department, and also to Veva Islas, who we hope will be able to connect shortly for the later conversation. Peter Long and Elizabeth Mitchell and Alina BQ have been closely involved in this in a variety of ways over time and are central to the effort. I'll underscore in that respect the special privilege from my perspective of sharing the time with Steve Teutsch and Elizabeth Mitchell, who were key members of the Vital Signs Committee panel, and with Peter Long, whose work in California and with the Blue Shield of California Foundation has really spearheaded much of the interest in this respect. Indeed, it was conversation with Peter and his colleagues that stimulated our work around vital signs. So with that bit of appreciation expressed inadequately, but nonetheless with real conviction, let me give you a little bit of the context for the vital signs work by referring to our most recent initiative, which is called Vital Directions for Better Health and Health Care. When I say our most recent initiative, I'm referring to the work released earlier this year by the National Academy of Medicine, which is an effort that has provided essentially a blueprint for the new administration to engage the most important and compelling issues in health and health care for the nation. The National Academy of Medicine, as a result of its 1863 charter to the National Academy of Sciences, the mandate to serve as advisor to the nation in matters of health, health care, and health science policy. And with that mandate in mind, well before the election last year, indeed about a year and a half ago, we, given the fact that there was going to be a new administration under any circumstance, launched an effort to assess and engage the prominent opportunities for better health and health care in 3 general areas. The core goals that represent those 3 areas are better health and well-being, high-value health care, and strong science and technology. To undertake this effort, we pulled together over 150 experts from around the country, indeed around the world, but primarily from throughout this nation, to look at 19 topic areas and write 19 discussion papers, which were across those 3 areas of better health and well-being, high-value health care, and strong science and technology. You can see that even before I get into the details, that vital signs is important to this effort, if in no other form than the name. The name Vital Directions came directly from the vital signs work as an underscoring of the fact that these are essential issues for the nation's attention, and to implicitly indicate that we need to achieve these vital directions, the kinds of vital signs that we're going to be talking about today. The page that you see before you here is a snapshot of the report from the Journal of the American Medical Association, which conveys the summary cutting across all 19 papers of the steering committee who are listed here. And you'll see it's comprised of a steering committee which is highly visible, and many of whom are well known to you and have been partners likely to you in various activities. But it was this group that looked across the work of the 150 individuals after they had completed their 19 papers and identified common themes. Next slide, please. And essentially those common things can be characterized as 8 priorities in 2 categories: the action priorities and the essential infrastructure needs. The action priorities are 4: pay for value, empower people, activate communities, and connect care. I'll refer to those in a little more detail in just a minute. The essential infrastructure needs that were identified by the steering committee were measure what matters most, modernize skills, accelerate real-world evidence, and advance science. Now, those may seem as fairly simplistic and logical and not particularly novel priorities, which one might say is true with one major exception, and that is the state of play in each of these areas has changed dramatically with respect to our potential to make a difference over the last decade. We now have the ability not just to say it's a good idea to pay for value, but we have a commitment to move the healthcare delivery system away from a fee-for-service system toward a more value-based system. In terms of empowering people, we have a much stronger mandate and sense of what can work in empowering people. In terms of activating communities, we clearly have a better sense of the fundamental importance when dealing, for example, with high-need patients, especially of the need to bridge medical services with social services. And if there's any single adjective that describes our healthcare delivery systems problems, it's the fragmentation that is characteristic. So connected care is obviously important. Next slide, please. If we look at across these 8 priorities and identify one which is most critical on which progress needs to be made in order to accomplish what's possible in each of them, it's measuring what matters most. And that's what what we're talking about today in vital signs. We need to understand that while ironically, as we've become more skilled at our ability to measure things, the number of measures has proliferated, and we've, in fact, lost our focus on what matters most. We need to make sure that what we measure is really assessing the performance at the systemic level. And in addition, what we measure cannot be limited to measuring the products of our healthcare delivery system. It needs to be measuring the broader dimensions that are most important to shaping health prospects at the individual and the community level. Hence, the four-part structure, the sort of triple aim plus one that we see in the vital signs activity is essential to bring out the importance of engaging individuals, and that's the sort of the fourth aim of the so-called quadruple aim, if we coin a phrase. The importance of ensuring that community-wide improvement is better measured, assessed, and serves as the object of our attention, as well as we look toward ultimately a payment system which is focused on improving the health of the whole population, as is hinted at, for example, in the CMS initiative around accountable health communities. Clearly, the kinds of measures that will give a sense of what's happening community-wide are critical. So the short take is what you're doing in California is absolutely vital. We're looking forward to learning more about it and to continuing our collaboration across the board. So thank you very much.
Thank you, Michael. Thanks again, everyone, for tuning in to the first webinar in the ongoing series. I want to start by giving you a quick overview of the vital signs, this consensus report, and then I will outline our ongoing activities at the Academy surrounding the refinement, implementation, and partnership engagement around vital signs, which forms the guiding framework and convening platform towards measuring what matters most, one of the action priorities as outlined by Dr. McGinnis. Next, please. Vital Signs Core Metrics for Health and Healthcare Progress is a 2015 Institute of Medicine consensus report. Since the release of the report in April 2015, the report has been downloaded more than 16,000 times from all 50 states and Washington, D.C., and nearly 150 countries. With funding from two California-based foundations, Blue Shield California Foundation and the California Healthcare Foundation, as well as the Robert Wood Johnson Foundation, the then Institute of Medicine convened a 21-member consensus committee, drawing diverse expertise from the field to identify core measures for health and healthcare. I want to take a moment to acknowledge the tremendous work produced from the long deliberations from the committee members and staff. You'll hear from two of the committee members, Steve Teutsch and Elizabeth Mitchell, during today's webinar. What motivates this monumental report most likely resonates with the challenges and opportunities that you and your organizations are confronting every day in order to achieve better health at better cost. There are three main motivations. First, focus, to ensure that what we measure is indeed matters most. So resources can be deployed to focus on the right things, the essential elements to achieve the quadruple aim. This means not only focus on the healthcare component, but also other determinants of health. Second, consistency. Thousands of measures are in use today to assess health and healthcare performance, but their lack of consistency and alignment paradoxically limits their effectiveness and creates significant measurement burden. Vital Signs calls for consistency across organizations and geographical areas, so there are comparability and reliability of insights on the state of play at the institutional level, state level, and the national level. And finally, burden reduction. It is to move from the ever-proliferating deluge of measures to ensuring the burden of measurements is manageable. However, the development of core metrics is not to eliminate measures, but to ensure that organizations who are measuring them can be mindful on what other measures are essential to support their own organizational priorities. Next. The committee recommended 15 core measures for health and healthcare progress across 4 domains: healthy people and communities, high-quality care, affordable care, and engaged people. Some of the measures are more mature, with large number of validated measures already in use in public reporting, quality improvement, and payment incentive programs. Other measures will still require more evidence and strategic development to fill the measurement gap and data gaps. The report also enlisted a single best available measure for each of the 15 core measures, which largely guides the California demonstration project you will be hearing about today. Next. The full consensus report contains details on related priority measures and existing data infrastructure and gaps. For more information and to download the full report, please visit nam.edu/vital signs. Next. To put the vital signs to use, the committee stressed that they have to add value to existing measurement activities, and the progress depends on the leadership at various levels of the health system. Healthcare organizations, payers and employers, standards organizations, and public health agencies all have important roles to play to adopt, use, and update the core measures as something that is practical and relevant to the people they serve. At the NAM, we're actively building partnerships to put the vital signs framework to use. This is the first of a series of activities you will hear from us on how we're refining the core measures to capture priority concepts by building a national vital signs partnership network to foster learning and sharing, and by cultivating and supporting demonstration projects. Today, you'll be hearing about the first attempt to apply vital signs on the ground in 2 communities in California, with local stakeholders closely engaged in the process. Steve Deutsch. Steve, the mic is yours.